Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are checking in with a hot startup that just raised a Series B round, $60 million from such notable investors as Bond, Andreessen Horowitz, Obvious Ventures, Box Group, and Sound Ventures. So please meet the CEO of Tomorrow Health, which is in the very exciting home health space, but not the way you think it is. Please meet CEO Vijay Kedar. How are you doing?
Doing great. So excited to be here, Jess. Thanks so much for having me on.
Well, thanks for coming on, and congratulations on that fundraising. That's pretty exciting.
Thank you. Thank you. We're really excited about it, and more than anything, how it can enable us to expand our impact to patients in home-based care. So, looking forward for the chapters that come ahead.
Yes, very much. So we will hear all about that, but I need you to explain what you guys at Tomorrow Health do, because this took a minute for me to understand. So home health, but not the way that people would think. You guys are actually trying to fix the infrastructure that makes home health happen. So talk to me a little bit about that and how you're not like what we think of when we think of like a home health agency that helps people get medical supplies and durable medical equipment and da 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 da. How are you guys different? What do you do?
Yeah, absolutely. So I'll start by saying that I think today home-based care and the shift to the home is something that's widely accepted across the healthcare ecosystem as something that we want to enable. It's what patients want. Even prior to COVID, 90% of senior citizens wanting to age in place. COVID certainly accelerated that shift to the home, probably by about a decade. It's the highest value side of care. Treating a patient in the home is less than 1/10 the cost of doing so in an acute care facility. And yet the reality is so many patients have significant difficulty getting healthcare at home. And as you know, the inspiration for Tomorrow Health was a personal experience I'd had managing home-based care for my mother and experiencing firsthand just how challenging that could be. In our case, needing to coordinate across a dozen different home-based care vendors, taking 6 weeks to get the full breadth of home-based care that she needed. And over that time, having to readmit her back to the hospital twice in that first month. And so ultimately, recognizing that while there is so much need and demand for home-based care, unfortunately, the ecosystem is very challenged today. While 1 out of 4 Americans need some form of home-based care, 72% report significant difficulty in getting it. And so what's the role that Tomorrow Health plays here? I'll start by saying, our vision is to restore the home as a patient's primary place of care. And we do so by providing technology to streamline the way that home-based healthcare is ordered, delivered, and paid for.
Okay.
So you have in the home-based care ecosystem a number of different players. Most importantly, you have the home-based care providers that are actually delivering that care day in and day out. And that can span from medical equipment and supplies companies, home health agencies, other home-based care providers delivering skilled or unskilled services. You have the physicians and hospitals that are ordering home-based care and navigating that transition, oftentimes from the hospital or post-acute facility to the home. You have the insurers that are reimbursing that care and coordinating that care in many cases for their members. And then, of course, most critically, the patients, their caregivers, and their families that are receiving it. And what we found is that ecosystem today really isn't working for anyone. We talked about some of the challenges that patients face, but for physicians and hospitals, there are often significant operational challenges with ordering home-based healthcare. For an average physician or hospital discharge manager, it can take up to 90 minutes to place an order for home-based care, involving faxing of forms back and forth to a myriad of different providers. For a hospital discharge manager providing 22 discharges a day, taking that amount of time can be incredibly disruptive, especially at a time when staff burnout is at an all-time high. For home-based care suppliers, they face a myriad of challenges. One of the most difficult is that many of these organizations are smaller, regional entities, don't have the capability to invest in better technology to do everything from the way in which they deliver care, but also how they operate their businesses, how they streamline an increasingly complex set of reimbursement requirements. And those challenges often lead to declining and challenging margins and challenges in finding sustainable pathways for growth. And ultimately, due to some of those barriers and bottlenecks, patient care is delayed. And that leads to folks, having to be readmitted back to the hospital or an acute care facility, which then drives up costs for insurers. So that's how we see the ecosystem today. And the role we ultimately play is serving as that technology layer to streamline and coordinate that process end to end. So we work with health plans at the regional and national level to help streamline and coordinate home-based care for their members. And the important distinction that I would say is that we're not taking over the delivery of that care. We're not replacing any of these entities across the system. We're providing technology to make their jobs easier and to make the entire ecosystem rewired to operate more effectively. So again, to touch on some of those key stakeholders, for physicians and hospitals, we provide software to reduce the time it takes them to place orders for home-based care by over 50%. Okay. We also provide them much greater visibility into the status of the care that their patients are receiving, which enables them to discharge patients more effectively and to have greater visibility into the care that's being delivered at home. For home-based care providers, we enable them to, one, grow their businesses more effectively by delivering higher quality care. Through our platform, many home-based care suppliers can see their businesses grow 200 or 300% just by delivering higher quality care. And we enable them to do so by providing clean, digitized orders for home-based care, by providing them software to streamline everything from basic operations to reimbursement, and then ultimately to provide the resources to deliver higher quality patient care in the home. And ultimately, the benefits of all of those are really ensuring that patients get the care where they want to be at home, but when they need it. We've been able to deliver over 97% on-time starts of care versus what is typically a market average of 50%. We've been able to deliver an over 95 NPS score across the breadth of patients that we've touched. And then in doing so, we keep patients healthy and safe at home and critically out of the hospital, which drives savings for our insurance partners. And so in that way, it's providing that technology layer to enhance how that ecosystem operates.
Okay. So tell me, the part I'm like the most interested in about this is the payer side of this, because I feel like that's like, it's like, of course, of course, if you're a patient and you can, get better at home, you're going to want to get better at home instead of be in a hospital. I mean, of course. And I think for providers, having that greater visibility or this ease of ordering that you've explained, just how challenging that is. I had no idea it took that long for those types of things to be set up and ordered. I think you explained that really well. And also, the benefit to the supplier. But on the payer side of it, can you talk a little bit more about that? And the reason too I'm interested in this is like I read a little bit about your background. You came out of Oscar Health, so it's like you're somebody who is very familiar with the ins and outs of a health plan, and so your client is the health plan. What are like the specific challenges that you're solving for them? Because that's something that I think like I just don't fully understand. I mean, of course, recovery is faster. The patient outcomes are there. The studies show it, but it's like the payers got big muscles. Why aren't they flexing them to make home health, work for them? Or what are the challenges that they haven't been able to fix that you're fixing for them right now?
I'll start by saying I experienced this problem firsthand from the payer's vantage point during my time at Oscar. I had the opportunity to join the company early days in its history in 2014, and helped to contribute as the company grew from a pretty small team to a few thousand, and driving presence across a number of different states. And During that journey, helped drive the company's efforts on the strategy and finance side, moved down to Dallas, led the company's Texas division as general manager, which we scaled into Oscar's largest state division, and then drove a range of efforts on the care management front and as it related to clinical strategy with a particular focus on complex case management and the shift of more care to the home. And what we found as an insurer is while we were so motivated to shift care outside of the four walls of hospital home, we had a number of operational challenges in doing so. First was in every market we entered, we were working across a range of, hundreds, if not thousands of home-based care providers, which provided, basic operational challenges and complexity. The second was from the care management angle. As we were looking to manage streamlined transitions of care, it was often difficult to coordinate across the breadth of home-based care providers that we needed to get our members either the equipment, the supplies, the services that they needed on time to be able to safely discharge them out of the hospital and to keep them healthy and safe at home. And so what we began to see was an increase in delays in discharge, readmissions back from the home when we and our care coordination teams have worked so hard to transition folks home, and also a challenged member experience. And so it became clear while so many stakeholders were so motivated to shift care to the home, the infrastructure to enable home-based care reliably and at scale was simply lacking. And from digging in a little bit into that problem, really understood two things: that for most health plans, they, as you noted, have that responsibility and have that capability to not only build a network, to set benefits, to determine which home-based care providers are in network, how they'll be reimbursed and compensated. But they actually don't have a lot of engagement in the level of care that's delivered. They are, a few steps removed from that ecosystem and that end-to-end process to get the patients the care they need. The second is that in many ways, some of the standard requirements that a payer has around billing rules, prior authorization elements, many of which are important to manage that network and manage that ecosystem, oftentimes levies significant operational challenges on the providers delivering that care. And so unbeknownst to both parties, it drives a range of kind of operational challenges that actually leads to outcomes that no one wants, which is delayed care, delayed discharges, or readmissions. And so what Tomorrow Health does is, we come in to our payer partners, and we really serve as a technology layer on top of that home-based care network. So we collaborate very closely with their existing teams around network management, care management, clinical leadership to really understand their home-based care strategy and priorities, and to deploy technology effectively to streamline how their home-based care networks operate.
Okay.
And we get to that next level of depth beyond just the construction of the network to actually enable it to operate more effectively. And really what's critical to bring that to life is technology that is purpose-built for each stakeholder across the ecosystem.
Yep. That
streamlines, again, the way that physicians and hospitals order, that streamlines the way in which home-based care providers are able to manage their operations and deliver that care, that provides a greater breadth of visibility to care management and to care coordination teams, and critically enables patients to get higher quality and higher value care.
So tell me this. So your client is the health plan, right? I think I saw you guys are working with Geisinger Health Plan, Aetna. You've got a number of others that you're working with. So talk to me about how you guys get paid. Like, what is your revenue model? Like, how does that work with the clients that you have?
We are compensated by our health plan partners through multi-year contracts, focused on enhancing the way in which their home-based care networks operate and the quality that is delivered. So ultimately,
This sounds so value-based care to me.
and that's a lot of the focus.
Yeah.
The reality is, home-based care is a space that is absolutely operating in fee-for-service constructs today, because it's otherwise challenging to align incentives appropriately. Many of the value-based care models we're seeing today that are effective are the most holistic ones: risk-based primary care, full global capitation models on subsets of the population. While we want to shift more care to the home, it is difficult for home-based care providers, especially smaller fragmented ones, to take global risk on a patient population, to impact care beyond the setting in which they're able to operate. And so today, as a result, it is very much a fee-for-service ecosystem. Just like any other subsector in healthcare, that creates a whole lot of inefficiencies. There are not really the incentives today in the home-based care ecosystem guiding towards higher quality or more efficient care. And in many ways, what we help our health plans to do is to put in value-based constructs that enable and reset those incentives towards higher quality, higher value care delivered by measuring and incentivizing clear, robust patient outcomes, and providing the home-based care providers not only the tools to succeed in that environment, but also critically the data visibility on their performance. And that is something that very few home-based care providers have had to date. And that combination of incentives plus tools and support unlocks some of these outcomes, which have been difficult to achieve in the home-based care ecosystem to date.
Okay, so this home health space to me is like one of the most exciting spaces to watch, but I feel like it's like such early days with even like the more innovative health tech type companies that are in this space, or even those that are just kind of, tackling from a health innovation standpoint the way care is delivered. So I mean, like we've seen Walgreens make some moves in terms of making investments in this space, Best Buy, and then you've got like, a number of like new companies that are out there like Signify Health or Honor. Like, I mean, there is a lot swirling in this space. My question for you is like, I like to always ask about like the competitive landscape, but it's like, I kind of feel like, you know what, the competitive landscape is there, but this space is so big and there's so much room. I want to ask this differently. And I want to ask you, like, what do you see as the biggest challenge for Tomorrow Health when it comes to scaling? Because this space is so big. I'm just curious, like the thing that keeps you up at night where you're like, if we could only fix this, rocket fuel growth.
Yeah. So I'll say two things. If the first, when we think about the home-based care landscape, is we are absolutely in early days. When we think about the size and scale of the problems that all companies in the home-based care space are aiming to tackle, I really believe we're in the early innings of the overarching shift of care to the home, but also many of the partnerships, processes, and technology that will enable the home-based care ecosystem to really be humming. And I'll also say, from our vantage point at Tomorrow Health, when we think about a range of other innovators in the space, whether it is companies in remote patient monitoring that are developing innovative technologies to enhance the visibility and the quality of care that's actually delivered to patients in the home, when we think about home-based care providers and companies driving innovative efforts to get real-time care into patients' homes to improve the clinician experience, when we think about companies working with payers to streamline, for example, their benefits in this category, others, we really see these as partners, not competitors, because in so many ways, our focus is on providing the technology to connect these pieces together, to connect what has for too long been a fragmented and disjointed home-based care ecosystem into one that is a lot more streamlined, coordinated, and has visibility for all of the stakeholders involved. And that is a level of coordination that really benefits all players in the ecosystem writ large. When I think about what are some of the challenges to scaling, the biggest challenge is just overcoming inertia. This ecosystem and so many stakeholders have just been used to operating in a given way, that adapting to different forms of change often drive reticence, and that's totally understandable. Where we have found really meaningful success with our partners is really taking a specific approach to helping to understand not only just their home-based care strategies, but their overarching clinical strategies, their overarching care delivery strategies, and how home-based care can effectively fit into that, and partnering with their teams as a collaborator to really provide the tools and resources to bring those to life. And I'll say, we're seeing today an unprecedented amount of demand from potential partners, from regional and national health systems, from integrated systems, from risk-bearing providers, from innovative home-based care companies, to really expand our footprint and expand our partnerships to be able to deliver this level of coordination and support across the full ecosystem end to end.
Okay. All right. Last thing for you then. Let's hear about this fundraise, the 60 mil. What are you going to do with this money? Like, what's on the strategic roadmap that we should be keeping our eyes out for?
The principal focus is growth.
Okay.
So first, capitalizing on the interest we're seeing from partners and customers to really bring on a wave of new partners across the ecosystem. And, that is, one, new health plan partners, national payers, regional payers, integrated systems, provider-sponsored health plans, new provider partners. Today, we work with tens of thousands of hospitals and physicians across the country, home-based care providers, and that's everything from traditional at-scale home-based care providers to innovative companies, to smaller regional companies, channel partners across the home-based care ecosystem. We always welcome those dialogues and that engagement to find complementary ways to work together. The second is expanding our presence into new state markets across the country, and being able to bring high quality, streamlined, and efficient home-based care to more patients. And the third is really expanding our investment in our market-leading technology. Ultimately, technology is at the core of what we do. It's what enables us to deliver these outcomes for our stakeholders at scale and provide that level of connectivity across the ecosystem. So continuing to do that. And I'll say, none of that is possible without our team. We've been fortunate to bring together an incredibly diverse team towards our mission, diverse in many respects, from professional backgrounds. We have world-class engineers, product managers, business development leaders, operators, and clinicians, from a diversity of personal backgrounds. Over 63% of our team is female. We have representation across the board, and we find that is certainly a strength of ours. Not only the quality of our talent, but the diversity of our talent in what we're building. And so we are absolutely expanding our team right now. That's certainly a big focus of the capital. We're growing actively across technology and engineering, product and data, on the business development side, and in operations, and looking for deeply mission-driven, passionate folks to really help us achieve our overarching vision to not serve 100,000 or 1 million patients, but to serve and impact 100 million patients and families. All
right, that's very exciting. If you want to work with Vijay Kedar, the CEO of Tomorrow Health, you can head on over to their website. I'm sure there are plenty of places that they can apply for a job on there. Thank you so much for joining me and for telling us about what you're doing and the technology that you're building. I mean, it's really exciting to hear so much going into remaking the infrastructure that makes home health possible, because that to me just means it's like literally building the road that is going to take us out of the hospital and into the home. So that is really exciting stuff.
Absolutely, Jess. Such a pleasure to be here. And thank you so much for having me on.
Thank you again. For more conversations with the who's who of health tech as they're changing the way that we do healthcare, head on over to my YouTube channel. That's youtube.com/WTF Health. Don't forget to apply for a job at Tomorrow Health if you want to work there. And we'll check in with you guys soon. We'll talk to you later, Vijay. Thank you so much.
Thank you.